Welcome to The PA is In, the show created by PAs for PAs, where codependency with your supervising physician is a thing of the past, optimal team practice is the future, and physician associate has taken the place of physician assistant as the professional title of choice. I'm Tracy Bingaman, and I'm obsessed with redefining what success as a PA looks like and what it feels like. Here you'll find the mindset shifts, systems, and processes I use to escape healthcare burnout and integrate my work into my life. Work-life balance is a myth, and an integrated life where you thrive professionally, not a balancing act, is the goal here. My mission is to help you to grow into a unicorn PA who loves their job, has abundant energy, time to spare, and work-optional financial freedom. The PA is in. Welcome back to another episode of The PA is In. Today, my guest is Sarah Sagorsky. Sarah is a medical oncology PA and a mom of two who's going to share with us the importance of community and her experience with burnout and the burden that comes along with taking care of cancer patients day in and day out in the office and in the hospital. If you have been feeling this increasing mental load of all of the things you have to do for your patients, if you have been hungry for connection and a community in healthcare, you are not going to want to miss this episode. Without further ado, here she is, Sarah Sagorsky. Sarah, welcome to the show. Thank you so much for being here.
Thank you for having me.
I would love it if you could introduce yourself, tell us a little bit about you and what you do clinically and also in a consulting role.
Yeah, that's great. My name is Sarah Sagorsky. I am a physician assistant at the Johns Hopkins Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins. I've been in my current role for 13 years. I work in the thoracic medical oncology department. In January of 2023, I took the lead advanced practice provider position within our group. I see both non-small cell and small cell lung cancer patients, as well as mesothelioma. I see about 25 to 30 patients a week, and I do 3 days of outpatient and 1 day of inpatient.
Nice. So you have a mix of seeing patients that are acutely hospitalized who are undergoing treatment and then also managing people who are, more stable and outpatient?
I do. In my outpatient role, I manage patients from their initial diagnosis through their treatment journey. With newly diagnosed patients, I would typically do an H&P, order labs, interpret them, order next generation sequencing, and review that with patients, and then see patients that initially start their treatment, do patient education, and then monitor them throughout any toxicities related to their treatment. And then I help like I said, I would help manage a wide variety of toxicities from the cytotoxic chemotherapy, immunotherapy, and their targeted therapies. For my inpatient role, it just started within the last 2 months, but 1 day a week, any of our oncology patients that are admitted at the Johns Hopkins Bayview campus, we will see them and help manage their comorbidities and issues and their oncologic issues while they're admitted to the hospital.
Okay. Yeah, that sounds super interesting. And like it's a lot to learn and a wide variety of things that you're helping patients with.
It is. I think patients like the continuity of care from the outpatient center to inpatient and vice versa. When they get discharged from the hospital, they have the same primary team being able to care for them.
Yeah, that's huge so that you're not sort of recreating the wheel every time you see someone that you know them and they know you. I can only imagine that patients going through this, it's a huge emotional burden for them, for their families when they're undergoing treatment. So I'm sure that seeing that same sort of consistent, friendly, knowledgeable face is huge for them.
I think it is. I think patients like that. I think it's really hard for them to tell their story for everything that they've been through up until diagnosis and potentially a toxicity that may happen or a few setbacks they may have. So patients really like that we know everything that has gotten them to the point to be inpatient, and then we can just roll that into their story when they transition back into being treated as an outpatient.
Yeah. So we're jumping ahead a little bit, but I kind of want to talk about, while we're on this topic, how that burden affects you as a provider. So these patients are not super healthy, right? They're going through a time that is, very intense. They're getting lots of treatments, maybe surgery, coming back to see you, then they're on monitoring. How do you deal with the weight of that and the heaviness of treating cancer patients on a regular basis?
I think that mentally, I think that it is, uh, there's a large mental load working in oncology. And I think that there is a large laundry list that we need to be able to care for those patients and know what happens and make sure that the coordination of care is there within the inpatient to outpatient setting, and then just being able to make sure that the other healthcare providers know what's going on with the patient. If we need to make any dose adjustments from a treatment standpoint, that we're doing that, and that also making sure that we're recognizing and anticipating things that patients may need throughout their treatment.
When you are working in healthcare, it can be hard to see the forest for the trees. Are you burned out, or is this a normal reaction to the stress that you experience on a regular basis? Is this a problem or just a rough patch? The Burnout Risk Assessment is designed to help you determine your risk of burnout, identify your strengths, and help you to build boundaries. Click the link in the show notes or head to tracybingaman.com/burnout-quiz. Spend less than a minute of your busy day stratifying your own risk of burning out in a field where burnout is incredibly prevalent. You'll get your results and a list of resources and podcast episodes that can help you at any risk level for burnout. Find the link in the show notes. Yeah. I kind of feel like medical oncology is like the PCP of cancer care, right? So there's someone who's really coordinating timing and logistics and, getting all of these things in the right, we want to do things in a certain order. We want to do things in a certain time frame. And it does feel like it's a lot to make sure that patient gets all of those things and to all the proper people in the proper timing. Do you have like a multidisciplinary team that helps with that? How do you guys work that?
Yeah, so I think we have a lot of support working in an academic center. If patients have early stage disease, so anywhere between stage 1 to 3, they're seen in a multi-D facet where they'll see medical oncology, radiation oncology, and then surgical oncology. So thoracic surgery sees those patients, and then a treatment plan will be implemented. We'll follow them throughout their treatment. So there's somebody that helps coordinate their care from that aspect. But to coordinate their care moving forward, I think that is a large role that I play. We typically will help coordinate whether or not we need to talk to their PCP, or if we need to contact their cardiologist, if we need to adjust medications, or making sure that the radiation oncologist is in the loop of things that we're doing. We may have to hold their treatment. We tend to, I would say, coordinate all the logistics and the communication with that. So I have been working with a company called POCN, the Point of Care Network, to help develop a comprehensive app for advanced practice providers to be able to improve the communication amongst healthcare professionals, have an accessibility of network from a peer standpoint. So we have our own network, and then we're also able to access educational material for our own continuing medical education hours that were required for our license. And then we're also able to contact patients in a HIPAA compliant way via the app. So the theory is that we'll hopefully be able to save some of the time from a clinician's perspective, being able to coordinate care for our patients.
Yeah, I think that is any of those tools that we can get our hands on or create if they don't exist, that help us to streamline what we are all trying to do, which is take really great care of our patients, right? Which requires phone calls and coordination and, contacting them and following up. Anything that can streamline that leaves us more time to be at the bedside doing what we really want to be doing, which is making sure, that patient feels seen and heard and is getting appropriate treatment. Have you been able to sort of beta test that community or like try it out?
Yeah, so we've been able to try it out. The app I don't think has officially launched yet, but we were uh, able to provide feedback in terms of how we can communicate within that. We're able to set up a kind of a group or I guess it would be like I don't know how you would describe it, but kind of like a network that's yours that you have easy access to, that you'd be able to send messages if they're the same referring people, or if multiple patients that I care for have the same primary care physician, I'm able to contact them. So we have tested it out, and I think that it's almost ready to be launched, hopefully this summer.
Yeah, awesome. So I would love to pivot a little bit and talk about your experience with burnout and sort of this stress and emotional burden that comes along with working in a high acuity, high stress specialty. What has been your experience with that, and how do you sort of navigate that stress on a regular basis?
Yeah, so I think you're right. I think it can be emotionally exhausting caring for complex cancer patients, and burnout can take some time to manifest. I think that it definitely happens when their pressures at work can hinder your ability to kind of cope with some of the challenges. Um, I think that it can present itself both mentally and physically, and in different clinicians, it can manifest in different ways. I think that as parents and professionals, especially being a woman, we tend to prioritize others before ourselves. So I've personally and professionally recognized that some days my home life is really great. Our laundry's put away, my kids have their lunches packed for the next day, our house is clean. But then when I tend to prioritize that, sometimes that means that I'm typically behind on my charting and emails because I prioritize those types of things when I leave the clinic.
Hmm. Yeah. Yeah. I once had a friend describe working motherhood, specifically being a mom who works in medicine, as like there's someone who needs me from the moment that I wake up till the moment that I go to bed, whether it's kids in the morning, patients during the day, kids in the evening. And it just was like a very strong image of this person who was like, I'm pouring out, I'm pouring out. I'm a caregiver, right? I'm a literal caregiver of my children. I'm a caregiver of patients. And, maybe my commute is 20 minutes, right? So 20 minutes of peace, but maybe I pick my kids up during that time. So really it's not that peaceful at all. So, it's good to hear like, hey, sometimes one goes well and the other one doesn't go well, because I think there's so many of us who are struggling with like, well, today I killed it at work and I was not that great when I showed up for my family.
Yeah, and I think that those days evolve for sure on our end. I mean, if we have to live out of a laundry basket for this week, then we have to live out of a laundry basket this week. The clothes are clean, the kids are happy, but at some point, we can't do all of it ourselves, all the time.
So, have you been able to like delegate or say, hey, here are things that are just like not a priority for us during this season to take things off of your plate?
Yeah, we have. I think that's hard to do professionally. So I haven't really been able to delegate as much. Do I need help at work? Yes. When I do I ask? Yes. So I think it's just prioritizing that. I think that at home, my husband and I have done that. We decided that for the summer, we're not going to enroll any patients, yeah, any of our kids in sports activities for the summer. They're 2 and 4 years old, so they don't need to do that. We're just going to give ourselves a little bit of grace for the summer and enjoy the pool. And when the fall boots back up, then we can decide if we need to do that.
Yeah. I think as parents, we sometimes focus on those organized sports or things as like, oh, we've got to get them in, they've got to get started, like they really enjoy it. But really, from a brain development standpoint, like what they need is like free play and to hang out and to not be like rushing to an activity every night. That's also what we need, right? As parents, like we need to not be like, okay, I'm going to get out. I'm barely going to make it to get them to the activity, because no one is thriving in that environment where we're just like super stressed and overscheduled and there's just so much to do.
Yeah, there's not enough time in the day to do all of that. And I think that knowing your limitations, what you can do, is the majority of the answer, right? I know that I can't wholeheartedly commit to it, and he doesn't know at 2 or 4 what he's missing. So we're holding off on it for the season.
Yeah. And I think sometimes delaying that, or just saying like it's reasonable to have a break from these activities. We don't do them all year round. And like, that's not the only thing that we can do for like fun or activity or movement, that there's all these different things that we can do. It's so sort of liberating to realize like, hey, I get to choose whether I sign them up or not. We have had seasons in our life where I hadn't really given much thought to like, what is a good amount of stuff on the schedule? What is too much? What is maybe not enough? I've never been in a situation where I felt like we had not enough on the schedule. So like maybe someday I will achieve that. But we have definitely had seasons where I was like, it's too much. I'm dreading certain days of the week because we're overscheduled and running in multiple different directions. So what we have found at our house is we'll think about like, hey, if it's one sport per kid per season, or like having some sort of a metric where this is our policy. Like, this is what we do in the summer. Our kids take breaks from that, very similar to your house. And it just feels good to have like, this is the boundary for these activities, because otherwise you're like, well, maybe they'll be behind in soccer. And then you're like, wait a minute, there too, right? We sort of lose perspective, I think, easily as parents.
No, I definitely agree with you in that aspect. This season, and I think that you're right. You just have to say, my kid is not going to be behind if we don't do this.
They'll be fine. Like, they'll be fine. I tell myself that a lot. Like, I'm like, especially when I'm sort of perseverating over a decision or something is really bothering me and I'm just like, I don't know. I'm like, they'll be fine. I usually say, and I don't know if this is just me like justifying my own like indecision or choosing to not do things. I say, when they're 25, no one's going to know. No one's going to know if I signed them up or didn't sign them up. It's not going to be like, oh, they would have been successful if only their mom had signed them up for rec soccer in the summer of 2023. No one's going to know. No one's going to know.
And it's so hot. What parent wants to sit out there in 95-degree weather?
Yes. Yeah. We like a little unstructured time in the summer also. So I would love it if you would talk a little bit about sort of along the lines of this, like connection, culture, community. How is the community where you work? Do you feel like supported and connected to your colleagues? What does that look like?
Yeah, so I think that culture and community are an essential part in the way that we care for our patients on a daily basis. So I agree with your statement earlier. We're working together towards a common goal, right? To be able to care for our complex oncology patients and to be able to provide the most comprehensive care that we can possibly have during one of the most challenging phases in their lives. So as I said earlier, I'm inundated with a lot of coordination of care for patients. And we have a really great support system here within the hospital. And I have a really great group of APPs that we share a lot of the responsibilities and cross coverage to make sure that the patients are well taken care of, and that we're able to, as clinicians, be able to take some time off so that we can get a little bit of a reprieve and make sure that we're being able to provide the quality care that patients deserve. And then, as I mentioned before, the point of care network, developing the app so that we're able to improve the communication amongst healthcare professionals. And then we're able to have access to new educational materials, and we're able to keep up on our CME things and be fulfilled from a personal and a professional standpoint, because we do need those CME hours, and nobody wants to wait until the last week and just try and stay up late and balance all that with a family. So it's helpful to kind of know that that's available. And I'm very subspecific, so a lot of the internal medicine stuff changes, especially with COVID, and just being able to see how medicine evolves over time. It's been a good resource to have quick emails that you can read that update with their updates, so that I'm aware of the latest in different subspecialties that I don't typically treat.
Yeah. I think that even though sometimes we work in a big center, sometimes we work in a small office, even when we're surrounded by other providers, sometimes we still feel like, is it just me? Right? Am I the only one who's like experiencing this? So that community sounds like a great resource for people to say, like, hey, I'm connecting with people. I think sometimes you feel better about talking to people who aren't in your workplace and they can offer an outside perspective. Actually, read a study once about burnout that said if your like partner or spouse is not in healthcare, that you're more likely to burn out, because healthcare is a very unique setting, very different than like business or like law or other areas of the world. And that having this community of people who get it, right, who've been there at the bedside, who know what it's like to have something super traumatic happen at work, to be taking care of a super sick patient, and then to have to like, keep going and see another one, or to sort of deal with that. I was just on the phone with a friend the other day who said, we were talking about work, and I said, hey, would you go back to that other position? We were sort of talking about different jobs and what we loved about them. And she said, I think culture matters a lot more than I originally realized. Like when I got out of school, I was like, what specialty, right? What specialty am I going to do? What area of medicine am I going to go into? And what we really, should be thinking about alongside the medicine that is exciting to us is like, how do I want to feel at work? Like, how do I want to feel when I leave work? Do I want to feel respected? Do I want to be part of a team where my ideas are valued? Because all of that, I think, has as much to do with our satisfaction and fulfillment as the specifics of the area of medicine that we're practicing.
I think you're right. I think so. I think that's a huge part of it. And I think that the people that I want to surround myself with are people that are going to cheer for me for my successes, and not aren't going to disregard some of the accomplishments that you have. So
Yeah, I think everyone wants to be seen and heard. Yeah, everyone wants to be, part of a team where you feel valued and you feel like, I'm making a difference in these patients' lives, which I think a lot of us know, but to have that validation or a team in which that is like, of course you are, and we like love when you win, we love when your patients do well. That supportive community is just, it's so important.
yeah, I think that we've given a lot of ourselves during COVID, with the limitations that we've had throughout a pandemic, that we're not as all we're not as quick to cheer each other on as maybe we would have been previously, because we're everybody doesn't have as much to give as they did pre-pandemic.
Yeah. I think that when you're tired, when you are, exhausted and overstretched and overwhelmed, you don't have as much in the tank. And I think that those like, cheering people on, being really encouraging, being upbeat and supportive, it's almost like the icing, right? Like if we get it, it's great, but like the cake is like doing your job and getting things done and making sure patients are cared for. So when we're not at 100% capacity, I agree. I think that is an afterthought. Like and maybe we're even thinking like, hey, Sarah's doing a really great job, but we're just like, we just keep going. We just see our next patient. We just keep going. It's an important reminder to sort of say like, it doesn't take that long. I always tell my students like kindness is free, right? Being kind to everyone that you encounter, whether it's like the cleaning people or like your attending physician, like kindness doesn't cost you anything. Like just being nice will go a super long way. But also the next step to that is like saying like, hey, Sarah, I saw you do a great job with that unhappy family member. I see that you're taking on more. I appreciate your leadership, because that is what keeps us going. It's what keeps us coming back. It's what keeps us on a team that even though it's stressful, that we feel like this is where I want to work. This is where I want to be.
Yeah, I think you're right. I think some verbal reassurance goes a long way. And you're right, it is free to do that. It's free to be kind. I think that we all have other priorities. We all have things going on at home. But at the end of the day, we all have the same common goal at work, is to be able to care for the patients so that we can get home.
Time marches on, and as we age, we are losing collagen at a rate of 1 to 2% per year. Collagen is the single most abundant protein in our bodies, and it's necessary for healthy bones, radiant skin, resilient muscles, and well-functioning joints. To combat the loss of collagen, I've been using Liquid BioCell Oral Collagen from Modere. I love this liquid collagen so much that I decided to partner with Modere to offer you $10 off your first order. Use the link in the show notes to redeem your discount today. I had a surgeon. I feel like I'm telling a lot of stories on this episode. I'm like, I have a lot to say, but none of it's my own. It's all a story from someone else. I used to work with a surgeon who would say, my mission is to take exceptional care of my patients efficiently and effectively so I can get home and take really good care of my family. And I love that that person was saying like, hey, this matters. I want to do it well. I want to do it, I'm not going to rush. However, I do prioritize getting out. And I think that's such a great example to set for your team. We would have medical students and residents like rotating with us. And this person would say that. And they were always like, wait, what? Because I'm like, this is a surgeon, right? Surgeons are not known for their like great work-life balance and like getting out on time. But to hear someone saying like, hey, this is a priority, but it's not my only priority. I have a life outside of here and I want to get home for dinner. And if that's a priority for you, great. We're going to work efficiently so we can get notes done, so we can, especially if we're not on call, leave on time. If we're on call, who knows? But
yeah, you don't know what that's going to bring. But I agree. I think that's hard for people to verbalize. Family or no family, everybody has a life outside of work, and it's okay to want to be able to be present and to do things that fulfill you in that aspect.
Yeah. I think healthcare has a long history of sort of normalizing martyrdom, that we have just made it like, hey, you sacrifice your, mental health, physical health, your whole life at the altar of like training. And then you get out and then it's more, right? Then you're learning a new specialty and you're onboarding and like more and more. It's refreshing to hear like, hey, we're all people, right? We are not providers. Provider is what we do. Person is who we are. We are people who happen to provide healthcare to other people. And that humanity, if we can, remind people of that humanity, if we can bring that humanity back to healthcare, I think that's, I want to say I'm not sure it's half the battle. It feels like a big deal in this. Like, yes, like I feel like it's a big part in sort of saying like, we see burnout. We know it exists. We don't want that to be the norm. We don't want self-sacrifice to be just like the standard that we're doing in healthcare.
And no, I think that everybody's work-life balance is kind of always evolving. And I think it's based upon, what your needs are at home and what the needs are of the clinic. And you kind of figure it out.
Yeah. Yeah. And that no one is doing it perfectly. And you can have a great day and then a really bad day. Yeah. Sort of normalizing. It's a moving target. I have another coach that I follow who says like work-life balance requires constant recalibration, which is like just what you're saying. Like you've got to check in. What are the needs at work? What are the needs at home? When things crop up. And for us, this has been a huge thing, especially when our kids are young and like, I don't know, every day is a potential ear infection. I feel like I like want to knock on wood. Like I think we're almost out of the woods on ear infections. But that there were these seasons where we would literally look at each other at the beginning of the week. And I would say, listen, if someone calls out sick of our kids and needs to come home, like I will do it Monday and Wednesday, but I'm in the OR Tuesday, Thursday. So I need you to cover Tuesday, Thursday. And sometimes we would go so far as to say like, if it's Friday, like, can you call your mom? Like, what can we, right? Like, what can we do so that we can like make it through the week and it's not like 9 a.m. Are you going to go or am I going to go? Like in our marriage that we were like, hey, who has more flexibility? Who has more bandwidth to deal with the sick kid who obviously needs like a parent and to go to the doctor and for someone to be home with them? How have you guys navigated that with like little ones who have ears? I'm sure.
It was a really tough few seasons for us. So like I said, I have a 2-year-old and a 4-year-old, and my work-life balance is always evolving. My husband has a career too. And I think that typically I would say my work is always evolving and I'm always adjusting the priority list depending on kind of what my home life needs and what my patients need. So we also have called for help. My family doesn't live too close, within a few hours, but I certainly have done that. Uh, at times, my husband and I have also said, you're it, or we alter depending on the days of the week. But I think the biggest thing that I had to get over was, if my kids are sick, they're my number one priority. And I think that's what my team should know too, that your family will always be your number one priority. Your most important job will always be mom. And it doesn't matter how old your kids are, if they call you and they need you, you need to go. And I had to rely on my coworkers, because at some point in time, they're going to have to rely on us too. There, and I think we have to take the guilt out of that. That it's okay to ask for help. It's okay to ask for help as a female, and it doesn't mean that they're putting extra work on us. It's, I need help now and I will repay it later. There shouldn't be a guilty feeling in there.
Yeah. And I think that, I mean, I do think this is getting better from like a mom versus dad standpoint. It still sort of pisses me off that there's like no one's walking around calling my husband like a working dad. He's just a dad, right? I'm a working mom, but he's a dad who happens to have a job, right? Like no one is saying like a working, oh, he's a working dad. Um, but that it's it's giving your coworkers the opportunity to support you in the way that you would happily support them, right? So if they say, "Hey, I got something happen, I gotta go," you're not like, "Oh, I'm so mad that they're like prioritizing their husband's health." No, you're happy. We'll rearrange. So and so will see these ones. These ones will get rescheduled. Like everything is fine, and we're not criticizing them. And like a culture where like the one you're describing, where you're like, I do it, you do it, this is the expected norm. Like it's no one's kids are healthy all of the time. No one's family is stable 100% of the time. Like there's seasons. Like this year, we had so many cases of strep. I never want to refill another prescription of amoxicillin ever again. Like I'm just like, I don't know where it's coming from. All of my kids have had it repeatedly. And like during that season, you're just like holding on, waiting for them to not be sick anymore. But that's not forever, right? That you're not like, I think the tendency of like, if you're feeling guilty about it, you're not abusing it. That's how I feel. I'm like, if you like are like, I don't know if I should, yes, you should call out. Yes, you should do the thing. And also for your own health, right? If you are sick, don't go to work, you know?
Right. Because I don't want to get sick if my coworker is, right? Because then I'm going to be out and then my family's going to be out. So I'd rather them just stay at home and we'll divvy up the work and everything will be fine.
Yeah, protect your coworkers, protect your patients, like call out when you're sick. That needs to be normalized. I do think we're getting there. I do think that this like work through it and suck it up. I think that is slowly going by the wayside in medicine, and we have learned to realize like, hey, we can't take care of patients if we're not well, right? It's not okay. It's not reasonable for us to expect that of each other or that of ourselves. And for some reason, we're so hard on ourselves. Like we would like see a coworker struggling and say like, "Are you okay? You seem like you need to go home. Like you seem unwell." And for us, we'd be like, "I'm fine." Why do we do that? I don't know.
I don't know. I think we're our own biggest critic for sure. But I think that COVID has forced us to say, I can't come in. My family has to quarantine, and so do I. Somebody is going to have to see these patients because it's not safe for you to go in. And I think that it's allowed us to say, okay, it's okay. I mean, if my kid is throwing up at home, I don't want to come to work, right? He needs me at home, so I need to be okay staying at home.
Yeah. And I do think that that quarantine and saying like, hey, I can't safely see patients, you know, whether it's for something contagious or just like I can't see patients because of some other reason, it showed us that like the world in fact did not end, right? We all want to be like super valuable and like, oh, we're so crucial. And you're like, it'll be okay, right? All the patients will be fine. Someone else will see them, we'll reschedule them. Like we put a little too much emphasis on ourselves or too much weight on our own shoulders when those situations arise. And we're like, but they need me. Like they need you at your best. They don't need you if you're sick or that someone that you love is sick and needs to be taken care of.
Yeah, I like that. You're right. They need you at your best, right?
Yeah. All right. So Before we wrap up, I would love it if you could share some of your, like a couple of practical tips that you have for not being burned out. And what I mean by that is like, how can you be healthy and well and thriving in a high stress environment or like an acute subspecialty like you work in? How can you sort of find a way to practically thrive in those situations, even though we know stress exists and it's going to be high stress at times?
So I think that's a really tough question. I think that the answer is always ever evolving. I think the first tip I have would be it's important to recognize the symptoms that you may be experiencing. So, why am I a little bit more irritable than normal? Kind of what's going on in that aspect, or maybe not be so defensive if your significant other may present a comment or constructive criticism to you, and kind of self guess or I guess maybe uh, think about it and just say, hey, maybe I am a little bit more irritable, or maybe I am more short fused with the kids. So I think it's A, important to recognize it, and then B, I think it's imperative to try to find strategies to mitigate the stress and burnout. So whether it may be things that you can do mentally to cope, I've had different providers that have used therapy, they've used meditation, acupuncture. There are different physical things that you can do, whether it be exercise. I think that's probably the biggest one that we as healthcare providers tend to do. Also, I think it's really hard to designate the amount of time to go do it, having a family and kids and things like that. But I think creating a plan to intervene with your partner or a coworker, if you notice that you need to step away from the situation or take a walk outside or to do something in that aspect. So creating a plan to intervene is essential, especially after this life-altering pandemic that we just went through, and working in the healthcare industry. I think that's super important.
Yeah. When I walk through burnout, oftentimes people will say, hey, if you could go back and tell your like pre-burnout self anything, what would you tell them? And I often say, I would say, you've got to listen to your body, right? Because when I was burning out, it was like whispering that something was wrong. And then it was saying that something was wrong. And then it was like shouting that something was wrong. And I was like, I'm fine. The whole time I was like, I'm okay. I'm okay. And my body was like, we're not okay. Like things are burning. Like this is not okay. This is not sustainable. If I could go back, I would be on the lookout for warning signs. I would identify like, hey, this behavior is not something that I would be like proud of. Like if someone saw me like speaking to my husband and my kids the way that I am, like I would be embarrassed, right? I'm talking to my family in a way that I would never speak to someone at work. And that should be a red flag, right? That should be something that I'm like, oh, I'm not showing up in the world as the person that I want to be. How can I backtrack? How can I identify the source of that stress? How can I, deal with that stress? Because we know that you could, have an amazing day, but like tomorrow, something will go wrong, right? Like stress exists because we have patients' lives in our hands, but we need those coping mechanisms. We need those strategies to integrate, an ability for us to be able to function in the face of all of that stress, for sure. So awesome. Well, Sarah, this feels like a really great place to wrap up. Thank you so much.
Yeah, thank you for having me.
If I've said it once, I have said it 1,000 times, and I will keep saying it until it is so commonplace and accepted that it no longer warrants saying. We are humans who happen to work in healthcare. We are people first and providers second. I love that Sarah was able to share the importance of taking time for you and for your family when things are going awry, and making sure that you're prioritizing your own health and wellness in the midst of taking care of all of the patients that you do on a regular basis. Thanks for tuning in to another episode of The PA is In. This PA is out. Congratulations. You've just joined an awesome club. By listening to a full episode of The PA is In, you are officially on the Unicorn PA team. Welcome aboard. What most team members do is they subscribe to the podcast because that allows them to automatically get the latest episode of the show. The life of your dreams exists on the other side of taking action. Keep making small shifts and keep getting better. Your life will improve, your career will soar, and you will have the confidence you need to create your own success. I will see you in the next episode. This PA is out.